Perfect. Good morning, everyone, and thank you for joining our workshop Wednesday. Hope everybody's having a nice warm day here in Las Vegas. If we want to start with the housekeeping, I can go to the next slide. So before we begin, this meeting will be recorded. Oh, let me go ahead and turn on my camera so everyone knows. This is Rebecca. Before we begin, this meeting will be recorded and shared with attendees. AI note takers and assistants are not permitted for Nevada Health Authority meetings. Previous workshops are posted here on this website that you're seeing. And the broker commissions, for commission-related questions, please contact the appropriate insurance carrier directly. We have no way to help you with commissions. So if you have any commission questions that are brought up, please contact the carrier directly. Issues with MFA, reach out to support line at 1-800-547-8156. And for specific case scenarios or technical issues, please submit a ticket through broker support. So today, this platform will not be to bring up tickets or scenarios that you're having issues with now. That would be going directly through the broker support email.
Right now, and then I'm going to upload her paperwork. I sent her to her.
Can you please mute yourself? Thank you. On the phone call today, we have our team. We have Janelle Davis. She's our Executive Change Officer. We have Jennifer Krepp. She's the Division Administrator. Katie Charleston is our Communications Officer. Tracy Reed is our Business Process Analyst. We have Tiffany Davis, who is our Tribal Liaison. Joseph Filippi, who is our Policy Manager. Myself, Rebecca Lamazzo, I'm the Broker Manager. Adam Plain, he is our Agency Manager for the Public Option. And we have Griselda Chapa, who is the Health Program Specialist.
Thank you,
So
Rebecca.
for the, yep.
Oh,
you want to go ahead? Okay, do you want to go ahead and take it?
Go through the agenda, and then I'll take it. Sorry.
It's okay. Our agenda for, we're going to go over plan year 2027. We'll also cover Medicaid Express. Katie will cover communications, our platform, PDM. We'll go over the Battle-Born state plans and policy updates. And I'll now turn it over to Katie.
Thank you, Rebecca. Good morning, everybody. So first, we're just going to walk through just a quick timeline on the plan year 2027, open enrollment, kind of what to expect in the coming months. So as usual, open enrollment will begin November 1st. In October is when plan preview begins. So that's when you can view the plans that are going to be available for the plan year 2027, whether you're a broker, consumer, or navigator. This is also October 1st is when the rates are released by the Division of Insurance. We also host our annual prep rallies during this time. We don't have an official date for those yet, but we're looking at the first 2 weeks of October. We host a prep rally in northern and southern Nevada. We're looking at doing the same locations as last year. And these events are great just to kind of get together, prepare for open enrollment. We have multiple people from the division speaking. So keep an eye out for that save the date in the next few weeks. And then November, December is our open enrollment period. In addition to securing new clients, make sure you're encouraging your existing clients to make sure that their information is up to date. Pretty soon we're going to have the pre-verification change. So we really want to get people in the habit of checking their information every year and actively enrolling. And then coverage will begin January 1st. We aren't sure on the end of open enrollment. I'll let Joseph speak to that a little bit and kind of what we're deciding right now.
Thanks, Katie. This is Joseph Filippi, Policy Manager with the Exchange. As Katie mentioned, we're currently monitoring federal regulation changes that are taking effect. As most of you know, last year, the Marketplace Integrity Rule was released, which required all exchanges to have a shortened open enrollment period. Typically, our open enrollment period lasted 11 weeks from November 1st through January 15th. We were currently planning to reduce that to 9 weeks to still start on November 1st, but end on December 31st. We're still working internally to decide if we are going to extend the open enrollment date through January 15th again. I'll talk about this a little bit later, but recently a federal court issued a vacate order on that provision, basically nullifying that requirement for all states and the federal marketplace. So many other states and the federal marketplace are reverting back to their traditional open enrollment period dates. In Nevada, we have not made that decision as of today. So as of today, we're still planning for a shortened open enrollment period, but that might be subject to change, and we will definitely keep you all updated in the upcoming weeks and months ahead of open enrollment.
Thank you, Joseph. So recertification for plan year 2027. So all of our brokers, navigators, tribal exchange representatives, and certified enrollment counselors who are certified for plan year 2026 will automatically have the opportunity to recertify with Nevada HealthLink. Only thing we need from you is to make sure that your email is up to date in your portal to make sure you receive the training link. We're going to try to align that with the portal emails just to make sure that they're up to date. So if you need to change that, please reach out to broker support or navigator support and we will make sure that it gets updated. And the training link will be sent out by end of day on September 1st to the email on file. That email comes from Trackstar Learn. It's a no reply at Trackstar Learn with the invite to the training. And then you will have until October 15th to complete the training. If you don't receive it by September 2nd, go ahead and reach out to broker support or navigator support and we will make sure we get you that training link. And we've already gone over this slide last month. I just want to give a quick update on this. So Medicaid Express is coming in the next couple months. It's just a new pathway for Nevadans to apply for Medicaid. Basically turns us into an assessment state to a determination state. We are developing the training right now, our partners are, and we are hoping to implement that in the recertification so you don't have to take an additional training. So hopefully that'll just be a module in the course that you're already going to be taking for your annual recertification, but a lot more to come on that. We'll make sure we have workflows and all of that set up before that begins. And these are just kind of some questions that we got prior to the meeting that I wanted to touch on. A question came up that if brokers are required to record client calls for Nevada HealthLink enrollments, that is not a requirement for marketplace plan enrollments. Another question is what happens when the client calls the call center? If you're listed as a broker of record on your client's account, you will be the client will be transferred over to you when appropriate. Your information is also included on their notices that are being sent from Nevada HealthLink. And on notices, if you have any feedback or you see anything that's out of date or that you think that we could improve, please let us know. It's always super helpful. So reach out again, broker support, navigator support, include the notice that you're looking at, any language suggestions that you have, and kind of your recommended revision or how we can improve those notices. We always appreciate your guys' feedback. And this is just a quick marketing opportunity. We put this in the broker newsletter, broker navigator newsletter a few weeks ago, but coming up in September, we would like to do a campaign called Meet the Experts, where we want to introduce our followers to you guys. So it'll be just a picture of you. You send me your name, your title, what county that you serve or city that you serve, what insurance tips you would give, any language spoken that you have available, and then a fun fact about you. And we will create the social post, tag you in it for you to reshare and just kind of shout out that free assistance. So if you would like to participate, go ahead and shoot me an email after this meeting, and I will make sure to get you in there. And let's see. So this is just a quick platform update. We don't have any significant other platform updates. This is really only affects consumers calling into the call center. But our current interactive virtual agent is being transitioned to a newer AI technology, which is referred to as Agent Virtual Assistant or AVA. So at a high level, AVA supports both voice and chat-based self-service interactions and will provide improved customer experience and increased efficiency. And the chat feature will now be available in Spanish. AVA will make communications faster, more convenient, and more personalized. AVA enables consumers to get self-service available 24/7. And AVA will help the QA team as a higher number of calls will be analyzed for quality, and this can lead to higher levels of customer satisfaction and loyalty. And now I will go ahead and pass it over to Nate.
Thanks, Katie, and good morning, everyone. My name is Nathan Osborne, and I'm the Exchange's compliance manager, and here with a few updates. First, we want to let you all know that we are currently approving exceptional circumstance SEP enrollments for consumers who ended coverage with plans sold by Innovative Partners American Collective following legal action by the FTC. Uh, this ECSEP aligns with the FFM and is valid through August 10th for consumers who provide proof. And I think all impacted consumers were notified. An example of the notice that we've been receiving, that we've been approving these ECSEPs for, is included on the slide on the right. Approximately 500 Nevadans are impacted, and I think we've only processed around 10 or less of these so far. So just a heads up. And we're considering doing some outreach directly to the impacted consumers as well, but we'll have to act fast and still working out that part. But next slide, please. Um, as most of you There we go. Periodic data matching for Planner 26. As most of you are likely aware, twice per year we are required to perform periodic data matching, which involves taking our existing consumers and rechecking the federal and state hubs for Medicaid and Medicare coverage and federal death and checking federal death records, and then issuing DMIs if a positive result comes back. We completed our second PDM run for Planner 26 on July 15th and sent out DMI notices to consumers that day. Um, about 700 DMIs were issued in total, including about 500 due to Medicaid coverage. And it looks like we're having maybe some issues with the slide deck, but I'll keep going. Um,
Are we back up? Sorry, Nate. Are we back up? Someone took control and I had to pull it back. Are you able to see your slide?
yeah, it's back up,
Okay.
but we're at the first slide. There we go. Back to the
Okay.
PDM slide. Um, all right. So we completed our second PDM run on July 15th. DMI notices were sent that day. We issued about 700 DMIs in total, including about 500 due to concurrent Medicaid coverage. All DMIs issued during this PDM have a 30-day ROP window that expire on August 14th. And an important note regarding the Medicaid DMIs that we wanted to flag: if a household has a previously manually verified non-ESI MEC document from a previous DMI, their dashboard will, on their enrollment platform, will continue to display the previously uploaded documents. And this is a known bug in the system and was part of, it was flagged for us during our last PDM run in April. Uh, Although we have fixed the problem, so as we've updated our PDM processes, so this shouldn't be an issue going forward. But anyways, it's a known bug. If the issue impacts your consumers, please contact the call center, and they can assist in uploading the required documents and clearing the previous DMI. Next slide, please. All right, I have a few account transfer / Medicaid eligibility reminders. Per federal regulations, consumers are not eligible for APTC if they're eligible for other MEC, including Medicaid. However, there are exceptions. If someone is already enrolled in a QHP with APTC and they report a change in their income, APTC can be kept while we wait for the final determination response from Medicaid, and that's to avoid a gap in coverage. Um, we continue to evaluate enhancements to the Medicaid application verification and account transfer process. We know sometimes there are issues with that. If you encounter a consumer experiencing an unusual delay with receiving a response, an AT response from Medicaid, please let us know. We can work directly with Medicaid to help investigate and resolve the issue. And just a couple of tips or reminders. Only submit one marketplace application, especially if it's going to be Medicaid assessed and sent to Medicaid. Duplicate applications sent to Medicaid can sometimes create operational difficulties and cause delays for us getting a response. And just a reminder, administrative or non-co-op denials are not considered valid Medicaid denials for the purpose of APTC eligibility. That concludes my updates. I think I'm passing it to the BBSP team. And I see some maybe questions in the chat. Are we addressing those at the end, Katie?
Yeah, we'll go ahead and
Yeah,
we'll collect them and run through them all at the end.
awesome. Thank you.
All right, thanks, Nate. This is Adam Plain. I'm the agency manager for the public option program. We just wanted to start off by recapping the public option and the battle-born state plans for anyone who may be new or was wondering about some of these changes. So going into plan year 2027, the state's contract for the battle-born state plans is with the same three insurers that it was for plan year 2026. It's going to be Anthem or their business entity, Community Care Health Plan of Nevada, United Healthcare doing business as Health Plan of Nevada, and Ambetter Silver Summit. All three of those insurers are offering battle-born state plans statewide in all four of our rating areas. They'll be available at our three metal tiers that we have in the state: bronze, silver, and gold. We just don't really have any platinum level participation in Nevada. And all of our battle-born state plans, to kind of reiterate this point, are qualified health plans. They're subject to Division of Insurance regulation. They're subject to Nevada HealthLink oversight. They are not Medicaid light. They're not an offshoot of Medicaid or a government-run program by the health authority. The state just contracts with commercial carriers to provide these plans. So that being said, going into some updates, wanted to touch on network directory accuracy. One of the things we encountered for plan year 2026 early in the plan year was some confusion amongst consumers, providers about certain network directories with the battle-born state plans. Specifically, I think it was the Anthem Community Care Health Plan of Nevada battle-born state plan. We worked with the carrier, with Anthem. That should not be an issue any further. There was some education to contracted providers. I think the name change was causing some issues there. That's been resolved, hopefully. Should not be an issue going forward. Provider participation. Some of you may know, you may have seen that the public option statute requires providers in the state of Nevada to be in at least one battle-born state plan network in order to participate in the Medicaid program, in the Public Employees Benefits program, and the Workers' Compensation program. That requirement was waived for plan year 2026 as we kind of figured out how we were going to enforce that, what the mechanisms were. We are in process behind the scenes to get that going. It is scheduled to go live on 1/1/27 in terms of enforcement. So hopefully we should see plenty of providers participating in the battle-born state plan networks. We had good participation to begin with, but this should ensure continued participation. Commissions. I know that commissions was a big issue for plan year 2026. I can't get into depth for plan year 2027, just straight off the bat. And we are in rate development season. Rates have not been approved by the Division of Insurance. Commissions are a part of rates, so I cannot get into detail with commissions. What I can say is for plan year 2027, Nevada HealthLink, the Nevada Health Authority, has made the offering of commissions a requirement to be certified as a qualified health plan and sold on the exchange. So all battle-born state plans will have a commission component for plan year 2027. Again, I can't get into more detail because the rates are still under development. And then the last item on my list is consumer complaints. This kind of goes back to the network directory item that I spoke about earlier, but just something that we wanted to bring to your attention as you're helping your consumers navigate the health insurance process is with the health authority, with the Division of Insurance, the fact that you've got Nevada Health Link and the exchange, the Battle-Born State Plan public option program, you have several on-ramps for contacting state agencies and state authorities when your consumers have issues. We want to ask that you work with us to get consumer complaint information to the correct folks. And I know that you probably won't know when you have a consumer issue who the correct folks are. And so our request is when you contact us, if you contact the call center and it's something that the call center for the exchange says, well, we can't really actually help you with this. We need you to contact the Division of Insurance directly. Or if you contact the Division of Insurance and they say, well, this is technically an exchange item, please help your consumers do that additional contact, to do that follow-up. Health authority staff, we're working with Division of Insurance staff to try to make the consumer complaint process as easy as possible. We don't want to have consumers feel like there's barriers. But for the time being, as we work these processes out, we really want to request that you ensure follow-up by consumers as much as possible so we can get the data we need, we can get the numbers and the complaints to the people that can really handle them and have the direct oversight. So again, that's just our request. Please do your best to guide consumers through that complaint process. We will do our best to make it as painless as possible, but there may be times where you're directed to another agency, another phone number, another email address, and we just ask you to help them take that additional follow-up step. So that's kind of the items that I have for our presentation. I'd be happy to move it along to the next presenter.
Thank you, Adam. Real quick before we move on, just one question came up in the chat from Brian Douglas. He says, thank you for doing that. It was desperately needed. Can you please clarify the rule on commissions for BBSP? Are the carriers required to provide competitive rates in comparison to non-BBSP, or can it be a different commission rate?
That's a great question. Unfortunately, I can't really answer that question because the health authority doesn't have rate oversight authority. I hate to direct you to another group, but that really is a Division of Insurance question. They have direct authority over the rates that are approved, what's considered an adequate rate, an excessive rate, a discriminatory rate design. So they're really, unfortunately, the only ones that can answer that question for you.
Thank you, Adam. I'll go ahead and pass it over to Joseph.
Thanks, Katie. Good morning again, everyone. I'm going to talk about a few different policy updates. First, we're going to talk about some Medicaid eligibility requirements that are coming, some immigrant eligibility changes, some DMI updates, and also other litigation updates related to federal rules. So starting with new Medicaid eligibility requirements, I know that you all are likely aware of this, but just wanted to highlight it. Beginning January 1st of 2027, the new work and community engagement requirements are going to apply to new enrollments and renewals for a large portion of the Medicaid population. Medicaid members must also renew every 6 months. And in relation to the marketplace individuals who are denied Medicaid due to not meeting community engagement or work requirements, they will not be eligible to receive marketplace subsidies. So even if they qualify, otherwise, if they are not meeting the CE requirements, we cannot issue them APTC. They can still enroll in a qualified health plan, but it would be a full price plan. And so additionally, sorry, if we go back really quick, Katie, I just wanted to note that on this slide, which will be shared after this meeting, that this link here, work, school, and volunteer requirements, that's Nevada Medicaid's website that has all the information you need, and it's going to be regularly updated in the coming weeks and months. related to these new requirements, about who it applies to, what are the exceptions to the requirement, and other information. So please keep that website, saved in your bookmark and refer to it regularly if you have any questions related to those new requirements. On the next slide, we're going to talk about upcoming changes to first Medicaid immigration eligibility updates that are coming. So in the next couple months, beginning October 1st of this year, only the following immigrant categories may continue to receive federal funding and receive full Medicaid or CHIP coverage. So those categories are lawful permanent residents or green card holders, Cuban Haitian entrants, and compacts of free association migrants. So that means basically these are the only three types of non-citizens that will qualify for full Medicaid. Other lawfully present non-citizens who have not met the 5-year bar may enroll into a qualified health plan. But starting on January 1st of this next year, 2027, if they aren't in these three categories, they will no longer be eligible for subsidies on the exchange. And that kind of goes into my next slide here, where basically the same three categories of non-citizens are going to be the only non-citizens that are eligible to receive marketplace subsidies, so premium tax credits. So any non-citizen beginning January 1st who falls into the income threshold of 100% FPL to 400%, they may receive marketplace subsidies if they fall into these three categories. Other lawfully present non-citizens may still enroll into coverage through the marketplace, but they will have to pay for a full price plan. They won't be able to receive any subsidies. And both of these changes are a result of the federal law that took effect last July, the One Big Beautiful Bill, HR 1. Looks like someone might be taking over the presentation again, if we can.
Sorry, Joseph, give me just a second.
All good. And I did include a link on both of these slides where there's a lot of helpful information related to these changes that impact the immigrant population. So for more information, please refer to that. You can also reach out to us if you have any clarifying questions. So next slide, Katie. Related to data matching issue updates, so this is also impacted by recent federal court decisions. We initially were going to plan on implementing the failure to reconcile policy this upcoming plan year. However, a recent court order discontinued that for both the existing plan year 2026 and the upcoming plan year 27. So all exchanges are not allowed at this time to issue a DMI for consumers who fail to reconcile their past tax credits. That doesn't mean that consumers are not required to still reconcile their premium tax credits each tax season, but if they did fail in a prior year, all exchanges for the next 2 plan years are unable to not allow them to receive future tax credits. I will say, though, that it's codified in HR 1 that starting in plan year 2028, so starting in January of 2028, all exchanges will need to issue DMIs for consumers who failed to reconcile for the prior year. So basically implementing the 1-year look-back policy nationwide, effective in 2028. But for the next 2 years, as of today, that's on hold. Additionally, recent federal court decisions requires exchanges to implement the income verification DMI, the 60-day extension. So in addition to the 90 days that we give currently related to these income DMIs, we are required to allow a 60-day extension in addition to those 90 days, so for a total of 150. And that's effective immediately. So Nevada Health Link is working to re-implement that 60-day extension automatically. So just wanted to share that for your awareness as well. For more information, there's a CMS statement linked there if you're interested. Moving on to more of the legal challenges. So specifically the 2027 NBPP, that's the federal rule that basically implements changes for this upcoming plan year. There's currently legal challenges on several of the provisions within that rule. I highlighted some of the provisions here that are on hold as of right now. So basically what that means is even though it was included in the rule, this court has basically put those provisions on pause and is going to make a decision eventually. We do not know the date that the court will make a decision, but as of right now, exchanges are not allowed to implement these rules and until the court comes to a final conclusion if they want to allow them or if they will nullify them as they have done with other rules recently. So just wanted to highlight that. Ongoing federal litigation is impacting and will impact new federal rules that may take effect this next plan year. And we'll continue to keep you all updated. Our intention is also to have our policy manual updated to reflect all of the current changes that are happening. So just wanted to notate that as well. On this slide, we're showing you that on our website, we added a new location for our policy manual. We had some feedback that it was kind of hard to find on our website. So under partner resources on the main page and under broker and navigator resources, there's a link here to our current version of the Nevada HealthLink policy manual. I hope that's helpful and more easy to find. And as I stated, the upcoming plan year policy manual, we typically release that around August or September. Our intention is to have the plan year 27 updates included in the policy manual by September 1st. So as soon as that's updated and available online, we will let you all know as well.
Thank you, Joseph. Before we go on to resources, I think we should jump into questions on here. So, sorry about that. Will that be listed as a reason that they don't qualify or no longer qualify for Medicaid? So I mean, that's in relation to the work requirements. So will that be on the denial notice that they don't qualify because they did not meet work requirements?
This is Joseph. I'll take that. So yes. So anyone who is applying for Medicaid and as part of their Medicaid eligibility are required to meet the work requirements. So for those of you that don't know, it's 80 hours per month of work, volunteer, or education. So they just have to prove that they're going to work, going to school, or volunteering 80 hours a month to receive Medicaid. If they happen to fail or not meet those requirements and we receive basically Medicaid denial due to their failure to comply with those requirements, if they do come to the marketplace and apply for coverage, we will then not allow them to receive any premium tax credits due to that failure to meet the community engagement requirements.
Thank you. Another one on Medicaid. When do Medicaid recipients need to renew in the months they enrolled or twice a year?
So all this is available also on that website, and we'll get that to you. Medicaid also, they had a workshop related to the upcoming federal Medicaid requirements that are coming. It was 2 weeks ago on July 14th. They have the slides from that presentation and the recording available on their website. I highly recommend you all go on there to review the website, review that presentation and that meeting recording. It's very educational. I believe that Medicaid is going to continue to have these stakeholder workshops in the next few months as we prepare for those upcoming requirements. So if you haven't already reviewed that webpage, please do so.
So people with employment authorization cards, work cards, are not eligible for APTC.
Can you say that again, Katie? Sorry.
They're asking if people with employment authorization cards or work cards are no longer eligible for APTC.
So as I'm honestly unfamiliar if those types of immigrants would fall into these three categories or not. Basically, we need them to meet the lawful permanent resident, Cuban Haitian entrants, or compact for free association migrants. If they have a work visa and they don't fall into those three categories, then no, they would not be eligible for premium tax credits. And that's starting January 1st of this upcoming year. Additionally, they would not meet the Medicaid requirements as well. If you have questions, though, when you have specific consumers that you're unsure of, feel free to reach out to us or reach out to our call center, and they can help work through whatever documentation your consumer does have available, so that we can verify what their lawful presence is. But yes.
Let's see, we have, did we clarify on this year if someone, when they reconcile their taxes, falls under 100% of the FPL, will they have to pay back their subsidies if they were denied Medicaid due to presence time frame? Will that also affect anyone under percent of the FPL? Sorry, I think I may have butchered that one. I think we can go ahead and open it up for questions. If you want to come off mute, Jennifer, Lawrence, if you want to ask your question.
Hi, this is Jennifer. So before, when we met back, I think it was like a month and a half ago, we had talked to Shay about whether or not someone falls under 100% of the FPL, will they have to pay back all tax credits? And we did not get a definitive answer on that.
So currently, this is Joseph. Thanks for the question. Currently, there is no repayment cap any longer. That took effect, I believe, January 1st of this year, to where basically anyone who is receiving premium tax credits, no matter their income level, and if they receive excess tax credits, they will be required to repay those back come tax season. And so that took effect this year.
Okay, really, but the question is if say I project myself at 150% and I come in at 90% when I do my taxes. So say I'm going to make 25,000 profit and I only make $15,000 in profit, which now puts me under 100% of the federal poverty level. The way it initially read in the beginning of the year when it came out is anyone under 100% would have to pay back all tax credits. Do we know if that's going to be the case when they do their taxes?
I will probably ask you to, reach out to the IRS on that. I think that they have a lot of guidance on their website about those changes. As you know, and as brokers, we're not necessarily required to give tax assistance or information. We really should be directing them to a tax professional. And so I'll say the same thing. For the exchange, we can't really give tax guidance. We just, I would think that the changes that took effect, no matter their income level, if they're under 100% or not, if they receive excess amounts of tax credits than what they technically were allowed, based upon their income, I would think they would have to repay those back. But I would direct them to the IRS for clarification.
Thanks so much, Joseph. And this is Tracy, Jennifer. I'll just add an addition to that. Although, yes, our main point is we can't give tax advice, right? But in your scenario, if you have somebody who has projected their income to be $25,000, as the year goes on, that's why it's so important to update that income and that information. If halfway through the year they're not on track to make that $25,000, it is their responsibility to report the actual lowered income that is looking like what's going to be their projected. So that's one of the reasons why it's so important that, yes, we take projected income as an estimate of what they think they're going to make, but as the year goes on, if they're not on track to make that amount, it is required for them to come in and readjust their income, throughout the year, and to see if they continue to be eligible for those subsidies. So I would just make sure that we're encouraging everyone to update their income if their projected that they've reported is not on track to be accurate.
Okay, thank you.
Can I ask a question? I tell my clients to update their income throughout the year, and I have even advised them to go talk to their tax preparers, and nobody seems to know what the number would be, how much they would owe. And I haven't found anything in the IRS to show what the cost would be if our client falls into that category. What other advice can I give to my clients besides updating or lowering their income throughout their year if we don't know how much they potentially will be owed?
I mean, I'll just jump in and just say I think that the most important thing here is to recognize that the importance of reporting income accurately. We all know, especially with self-employment, that sometimes it is hard to get a very close estimate of projected income, self-employment, sales jobs, things like that. I mean, those things can vary greatly. I think that that's all we can do as enrollment professionals is advising them, to keep track of their current income, and they will have a less likely chance of having any kind of tax liability as long as they are reporting their income accurately, throughout the year.
Hello, this is Ollie. I have a comment about this. Can you guys hear me?
Yes.
So my understanding was that there is the form 1095A, and when you do your taxes, there's a reconciliation. If you overpaid or underpaid, it's done at that time. I don't really, when I deal with clients, I ask them for an estimate. Accurately reporting an income for even right now for the rest of the year is very difficult, especially for people who lost their jobs, for instance. It's just not possible. And yeah, I think someone put in the comments that every time they will change their income, then they would just have to update the application and reapply, isn't it? That was my comment.
Tracy, do you mind confirming that if they go in and update their income, does it require them to fill out a brand new application entirely?
Sure. So, yeah, when the income is updated, when the income on the application is updated, it would only generate a QLE to upload document proof if the consumer's CSR eligibility changed. So, for example, they enrolled and they had APTC of $1,000 and a CSR level 5. And if they come in and change their income slightly based on what their actual projected income is going to be, if that changed their APTC amount to maybe 900 instead of 1,000, but still kept them at that CSR level 5, all it does is submits to the enrollment, changes that APTC amount going forward to the lower amount, and it continues on to the same plan. Now, if the income is changed enough where it's a big enough difference where it's actually changing the CSR level that they're eligible for, or removing or adding their CSR eligibility, that's when the system generates a qualified life event, meaning that income change is big enough to change their eligibility, which would open up a qualified life event and require proof of that income change to be submitted. So not every income change reported on the application would generate proof being required or generate a QLE. But if it does change the eligibility, then yes, it would generate that. Hopefully that answer helped.
Quick question on what was just said there. I remember this talked about for this coming for plan year 2026, but is there any changes with regards to whether or not you'll accept letters of attestation for income, or does it have to be other verification documents?
So I think that's one of the provisions that's currently under the stay order. There was going to be new income verification requirements for example, those who um, projected their income would be below 100% FPL. I believe they'd have to provide additional documentation, but those are actually under the current court-ordered stay, so they're on hold as of right now. We don't have really an estimate on when the court is going to come to a conclusion on that. We don't know if it's going to, be upheld and continue in this upcoming year, or if it'll be vacated and just, not take effect. But as stated earlier, any changes related to that, we will update you, and it'll also be included in the policy manual, and our platform will be updated to issue a DMI if necessary.
So Joseph, are letters of explanation accepted right now then for income verification?
I'll jump in. So right now, letters of explanation are acceptable forms of proof of income if there are no other documents available, right? And so right now, depending on what the consumer has available, if they don't have their tax return from last year or whatnot, then an LOE may be acceptable in addition to something else, right? But it is my understanding that LOEs can be used in addition to another document to explain why they don't have their tax return, why they don't have their, a monthly, or a paycheck, that kind of thing. So we always encourage submission of actual documents, not just LOEs, because LOEs are intended to be in addition to other documents that are submitted.
And thank you, Tracy. I appreciate that. Are you able to, there's a question, if their income went down due to the loss of a job for a period of time, they can attach some documentation to prove in order to get their premium adjusted due to more APTC. I think they're saying if they lost their job, can they update their income in their application so that they can receive more premium tax credits?
Yes, definitely. If the income went down, we 100% need them to update their application due to that loss of income. And again, that is for if they're losing their job and they only project no income for 2 months or whatnot, we're wanting to adjust that projected income for what they think it's going to be total for the rest of the year, right? And again, documentation would be required if that reporting that loss of income did change their CSR eligibility.
Christina, if they update to a lower income while being assessed by Medicaid, will they get to keep their subsidy? So I believe, Tracy, correct me if I'm wrong, if they're currently receiving a subsidy, they update their application and it looks like we need to assess them for Medicaid, they will continue to keep their APTC and QHP pending the response back from Medicaid.
Yes, if they do update their application to reflect that they are in now Medicaid range and eligible for Medicaid, that could remove subsidies going forward. So the application being submitted, if the income is updated to FPL rate that is definitely in Medicaid range, our system does remove those subsidies going forward while Medicaid assessment is happening. But again, that's a prospective, so it kind of gives the consumer time to get that Medicaid assessment. If for some reason they come back with that valid Medicaid denial, we can always reinstate the subsidies going forward.
No, Tracy, this is Nate. Just want to jump in. I think for new applicants who are under the Medicaid FPL thresholds, they won't receive APTC until we receive that denial. But if someone is already receiving APTC and they update their income and we send them to Medicaid, I believe they do keep their APTC while we wait for that response back. But they,
Thanks for that clarification, Nate. That sounds right.
okay. And that's a newish configuration, I think, within the last year or two. So
Sammy?
I had a question about the adjusted gross income with the new Medicaid approvals through the Nevada Health Link. Medicaid does not count deductions like Nevada Health Link. Is that going to be an issue? Is that going to be a continuous thing? Is that going to change? Medicaid counts all income, and Nevada Health Link only counts adjusted gross income. Example, child support, some deductions for work. That's my question.
We might need to take that back, Sonia, to the Medicaid eligibility team to get an answer for you. It's a great call out, though.
Thank you.
Hey, it's Brian Douglas. Did you see my follow-up on that, the mandate that you guys gave to all the carriers for the battle-born state plans?
I'm sorry, Brian, what are you referring?
Well, on the question I had earlier about the battle-born state plans, and you guys referred us to the DOI to figure out what was considered an equitable commission rate. The question, that wasn't the question. My question was, what was the directive given to the carriers by Nevada Health Authority on commissions on battle-born state plans? Did you say just you have to offer commissions? Did you say you have to offer competitive? What are the carriers reading from you guys on that? What are they going to assume you meant in your statement, and what was that statement?
Brian, Adam had to drop, but I will take that question back to him and get you an answer on that, okay?
Thank you.
Real quick question back. Sorry.
Go ahead.
Thank you. Real quick question back to the Medicaid assessment. I know in the past, Medicaid assessments were taking a very long time. Can anybody speak to different ways or avenues that we can advise our clients to find out, in a timely manner, what the determination was if they dip below and get Medicaid assessed?
This is Tracy. I'll just jump in. My biggest recommendation is to just make sure that the consumer follows up with Medicaid for any required documentation that they are asking for. That is the biggest thing that we see in delays in Medicaid determinations and Medicaid account transfer files, is if they are waiting for documentation or more information for the consumer. So when the consumer is sent to Medicaid, they are sent a notice if additional information is required, and they just really need to pay attention to those notices and follow up with Medicaid to make sure that there isn't anything else needed in order for them to obtain that valid determination.
Perfect. Thanks, Tracy. One other quick question on that. When they are Medicaid assessed, do you know how the client is notified? Do they get something in the mail? Do they get an email? Do they get a phone call?
I will defer that to another exchange member. I believe Medicaid sends out notices in the mail, but can anybody else confirm or deny that?
That's my understanding as well.
I wanted to make a comment on your question. This is Sonia again. When a consumer is waiting for Medicaid, my team and I transfer them over to the Division of Welfare and Supportive Services. The phone call normally takes about 3 hours, but they get approved or denied that same 3 hour time loop that they're on the phone, and the caseworker actually emails the notice of decision to the client. So if they really want a rush answer on the denial for Medicaid, transferring them over to the Medicaid phone system, they will get processed within that time frame that same day. As for the letters, every client gets postal mail notices.
Thank you so much for clarifying that, Sonia. Appreciate it.
We've got about 1 minute left. Thank you so much for all of your questions. We will post this meeting and we will also post a follow-up FAQ by the end of the week. And I will make sure to send a follow-up email to all of you as well. If you think of any other questions, please send them to broker support or navigator support, and we will make sure to get back to you. Thank you all so much for your engagement and being a part of this today.
Thank you.
Thank you.
Thank you.